Hello everybody again and welcome to another episode of Stock Talk. I am your host Mike, and Cameo, he is off for today. Hope you guys are all having a good week so far. Happy Tuesday. We're almost to the middle of the week, and then we'll be at Friday where you could even speed on the highway. I've got some great stocks for you today. I am going to go into some of the ones that I had a while ago, some that are movers and consistent. They're not subs. They are just regular penny stocks. They were cheap real estate. I've been looking and researching and they have gone up. So we are going to go into that. We also are going to go into as far as some with the giveaway. We're still waiting when Cameo. I've just been on vacation this week. And Cameo's, me and his time slots are kind of misconstrued. I got a little windburn today when I went out with the lake, onto the lake today, I was about 10,000 feet up, man, and it was beautiful. No more, it was too hot where we were, so we took a break. So I'm a little sunbeat today. So, but yeah, we're gonna jump into it. One of the first stocks we're gonna talk about today is VTVT. So get out your pencils and mark that one down. VTV Therapeutics. Currently the last tick was $2.52. It was up 6.78% today. Looking good there on that stock there. So what we're going to do is we're going to dive into it, check it out, and see what is cooking with this, the good, the bad, from as far as the alphabet channels, and then as far as from what we can see as far as analyzation of what we can go into with this company. Okay, before we get into the alphabet news, there's just a little bit of background of this company. VTV Therapeutics is in a clinical stage biopharmaceutical company which engages in the discovery and development of orally administered small molecule drug candidates to fill significant unmet medical needs. Now, is it, as if you can recall from a while back ago, I've discussed the clinical trials are when they hit at that certain point, these things start to move. There's going to be another stock that I'm going to talk about that I'd say, I think I had it in 2018. I believe it was Mankind. Mankind was in that's another stock I'm going to talk about with that one. We'll probably bring that one up because that one was in cheap real estate at $1.50. It's now $4 and change. So some of these, I know some people, when you pick these up, it's tempting because you see sometimes you're losing, but you gotta hold the line. If you don't hold the line, if you're a shorter, you know what you're doing and you're not holding the line. Obviously, you're doing what you got to do. But cheap real, when you pick up the cheap real, just don't buy on the high and get the cheap real estate and hold the line. You will make profit. I promise you, you will make profit as long as you make smart investment choices and not buying into a company that's out of a trailer park or in a garbage can or something like that. So with this company, it looks like they're in those clinical trials. They're working on treatment for the central nervous system disorders, diabetes, metabolic disorders, inflammation, and cancer. It also offers TTP 399, TTP 273, and there's some other ones for the BOC1 program. Anybody that's into that and wants to give them more information, go ahead and put that on there. The company was founded on April 2nd, 2015. It's headquartered in High Point, North Carolina. The listed name for VTV Therapeutics. That is the common stock name. So, what we're going to do is we're going to cover the alphabet news on this. We're going to see what the alphabets are saying about this stock, and then we're going to dive into the website and we're going to go and get kind of their take on it, and then we'll also dive into as far as what the investors are saying on Investors Hub, because on Investors Hub, that's where the real traders are, and they'll give you the 411 what's going on. So before you make your decision, you could go into what we find on the website, what the alphabets are saying, because the one key about the alphabets and some of them is that when you're seeing this, it is promoted. So if you're buying on the high green and you're taking off, yeah, if you're shorting, you're going to make some cash. But if you're not paying attention and you're going to hold the line when you're buying at the high point when it's being promoted, you're going to get your ace handed to you. Unfortunately, that's just how it goes. So try to get your stuff cheap. That's all I'm saying here. So we're going to go into, I found some stuff on the alphabets about this stock, and we'll talk about that one first too there. So the reference point on this news article from the alphabets I just covered on the top suggested searches from Google, there's a site called OwnSnap. Now OwnSnap says that this stock is assumed to grow VTVT 32%. Why do they say? So here's the key. It was stagnant, and this does happen. You will have stocks where they won't go anywhere for years. I can tell you one that I had, I can't recall it by name, but it was stagnant forever. And then the elections happened, regimes changed, and I woke up and I wasn't really paying attention, checked some things in some other accounts. There's some extra dineros in there. So some of these go dead and they go stagnant or they change and then they pop off. So it's kind of like baseball card collecting a little bit. But anyway, it says over the last year, VVT stock was stagnant, representing 3.1 on December 7, 2020. However, today's stock is predicted to rise and beat the previous record, reaching a new high of 315. Reason being, the company is on a roll. And it says, what's causing the sharp upsurge? Well, it looks like they announced today that they're entering the license agreement with Canex and will have exclusive global rights to develop and commercialize Azaligaron, VVT's unique rage antagonist, the receptor for advanced glycation end products. So it says the product on which the two companies were working essentially with type 2 diabetes is really essential in the type 2 diabetes for chronic and obstructive pulmonary disease, kidney failure, is the primary mitochondrial myopathies. So with this, it has that breaking news, so that's when it pops up. News is king. Sometimes no news is good news, but in this case scenario, news is good news. So that's one of the things that's going on, why this one's popping off. Let's go to the website, check that out, see what they got cooking. We'll get a little background feeling from them, and then we'll go to our favorite thing in Investors Hub, and we'll see what the traders are saying. Going on the website, looks excellent, guys. I mean, it's just standard. It doesn't need to be fancy or anything. But if we go on here, we got Grandma and Grandpa there. They're chilling in the mountains. Looks relaxing. And they just have their intro. VVT is a clinical stage biopharmaceutical company engaged in the discovery of orally administered small molecule drug candidates to significant unmet medical needs. They're working on, obviously, like we covered, type 1 diabetes and inflammatory disorders. Okay, so going on, they have the leadership, the board of directors. I'm not going to show that just because sometimes me and Cameo would do that just for fun, things like that, but we're not going to cover any of that there. They have, let's see, go to company profile. Let's go into that, check that out. Company profile. They got their link, so they're hooked up LinkedIn, got the normal thing, Twitter, all that kind of good stuff, and they have their little VTV section. If you go to their pipeline section, they have our programs are directed at treating metabolic diseases to minimize the long-term complications through end organ protection, and they have their graphs breaking down all their treatments, what they're trying to do, and the goals they're trying to achieve. So you probably have to do the desktop version of it because the cell phone the mobile version's kind of so-so. So that's just my take on that. Obviously, we have the new press release of why this has been popping off and why it's probably going to go off. But like I said, don't go and jump on this and be surprised Friday if they short it and they drop it out. But you got to pick your buy point. Remember, your buy point is whatever your entry point is. So looking at this, The latest press release is VTV Therapeutics and obviously Camtex Pharmaceuticals announced a strategic licensing agreement for the development and commercialization of azilaragon for treatment of cancer. Sorry if I butchered it. You can get me on that one. So they have their filings there. The PDF is actually on the website there. Let's see, it says here that Stephen Marcus, MD, President and Chief Executive Officer of Camtex, stated RAGE has been implicated in several serious cancer complications associated with increased mortality and decreased quality of life. Our team has a deep expertise and successful track record in transforming known drugs into innovative products with large clinical and commercial potential. They're also have an opportunity to develop phase 2 of oral medication for administered once a day. Looks like for several things for Alzheimer's as well. They're working on. So guys, we talked about a stock last week that got up into the teens. Okay, and it was cheap before years ago. You might not see this stock that cheap later on. I'm just saying. So these things, you just have to be patient. You know, Rome's not built in a day, things like that. So hold the line. We'll go check out what Investors Hub's saying as far as what the traders are saying, and we'll see what they're doing. And okay guys, we're going on Investors Hub. Now this is what the real traders are saying. Again, for anybody that's new here or any trolls or anything like that, these are not my words. These are the actual traders that are currently trading and what they're saying about the stock and what their feedback and what intel they have from things. So this is, if you have feedback, put it on the comments section. It helps other traders that are subscribers. One trader writes, VTV shorts are panicking, breaking of a $3 will. So that's all what he puts. Looks like there's a plug on Twitter for bullish 269. All in for 271. Bounce target 317. No shorting here, I see. So there are people trying to hold the line. And that's what I'm saying. You could short if that's your game. You will make coin. But this one is going to go up. When it's going to pop off, that's when they hit their their phases in their trials, when they get their drugs developed and their treatments developed. So that's what you got to look forward to. Any newbies out there, okay? So there are no shares to short available. That's what someone put on here. Great date here. VTV $. Screaming for the top. Running. Nice job, laugh out loud. Use Robinhood or TD Ameritrade. Neither. That was a joke. Taking my chances. I just bought everything back. Big pipeline. Bad decision for him that he signed that. Pearlman buys 600K plus at $1.60. Chat rooms are pushing this again. Buy it up. So guys, the chat rooms are blowing up. Things are going crazy. Don't do any. I would say on this is that obviously it's a decent buy. It's only going to go up higher. That's just my take on it. That this is going to go higher. It's not going to be this cheap for that long. So it's just, when are you going to buy? Are you going to wait till Friday to think if they're going to short? Because they could short and you could get a drop and you could get cheap seats. But also it might not happen. So find your entry point. Feel what you're comfortable. Don't risk anything that you can't lose, okay? Because sometimes it's all about how it plays out. But don't risk anything you can lose, and take a shot if you want to. And I'd say check it out, see what you think. So I'm done with this one. I'm gonna move on to the next one. Okay, guys, on this one we're gonna go a little bit into the cheap seats. This stock is ACST Pharma. ACST, and if I butchered the name, sue me. I don't care. So it looks like this one was up. It looks like 12 after hours. It's up 12 cents. So the after hour traders are moving it around. It was up 5 cents today. So it's not as crazy volatile a lot, but it's decent there. For this company, It engages in the development and commercialization of pharmaceutical applications of licensed rights for cardiovascular diseases. Key here, cardiovascular diseases. It affects a lot of people because, let's face it, according to doctors, a lot of Americans all of us are guilty of it. We don't eat correctly sometimes, and some of us have problems. So this company, 68 cents. If they're doing this and they hit their mark, and like I said, it's a guessing game again, but if they have the right things back behind them, they end up popping off. So if I go back into history of 2 or 3 years ago of some of the ones that I've traded that were change stocks, they're all gone. They're in the $3-4 range already, and they're not even at their full phases. So it looks like they focus on research of prescription drugs using omega-3 fatty acids derived from krill oil. Krill oil is huge, especially if they can do what they can do on this, guys. I'm telling you this, and you can bank it. You can put this in the bank. I watch a lot of talk radio, and I listen to a lot of talk shows. These talk shows all the time, I don't care if it's left, right, up and down, shooting straight. I don't care what talk you listen to. They're always peddling krill oil. Krill oil and nutraceuticals and pharmaceuticals. People buy it all the time. If these guys hit the right mark, your 68 cents and change is going to turn into more. Health stuff, as long as they have the right financials and the right backing behind them, they're gonna take off. Okay, that's why some people could come back and say, oh, it's because GTEH is down with the SynFit bars and stuff like that. We covered that one. That one's gonna come back. It's got the sales with it. So I'm not feeling bad that it went down, because I'm the type of person that holds the line. You want to think of long term. If you're a short term game person and that's your game, you got to do what you got to do. But this company was founded, it looks like, by Henry Harlan in February 1st, 2002, and it was headquartered in Canada. So it's a Class A common stock. So what we're going to do now, we're going to go to the website, we're going to look at some of the stuff they got going on. I'll scan the alphabets and I'll see what they got going on, because I'm not a big alphabet news person because it's just hand-picked. But pharmaceuticals, you can pretty much, you get some good news from the alphabet sometimes on pharmaceuticals. So we'll check out what they say, we'll see what the traders say, and we'll check out the website and we'll throw out, and you guys can leave stuff in the comment section too on that. Okay guys, news is popping on this stock. One of the top threads was on, it looks like Proactive gave a plug on this, and it looks like they were able to find out that it looks like they're supported by Grace shareholders from the boards of directors from both these companies. So Grace Therapeutics and ACST, they followed a merger, and they're expected to have more than $60 million in cash. That's huge, which will provide 2 years of operating runway. So it announced operating financial results in fiscal end year March 31, along with the update with its acquisition of Grace Therapeutics. So we got a merger here. The biopharmaceutical innovator reported a narrower loss from operating activities of $16.4 million compared to a loss of $24.4 earlier this year, due mainly to reduction of expenses. So maybe with the merger of these two guys, they can come together and they can come up. So don't get disparaged with some of the stuff that's there. These things turn around. They take time. Science takes time. You can't just throw crap together, things like that. So with this, that's one of the things covered in the alphabets. They also have their fiscal, Yahoo has a plug on here for the fiscal 2021 business update. They also have on the financial post on here, you can go into the 2021 year-end business update and acquisition of Grace Therapeutics. Grace Therapeutics, well, that merger, that'll help bring some cash, because these types of things take money. You got to have all the materials, you got to have the good scientists and things like that to do these kind of things, the doctors, all that kind of good stuff. So we're going to go to the website, check that out, and we'll see what we got. Hey guys, going on the website looks pretty good. They got some other stuff here that wasn't covered in the alphabets. It looks like with the acquisition of Grace Therapeutics, they're developing a pipeline of a rare and orphan diseases, including 3 clinical stage assets that have received orphan drug designation from the FDA. It's huge. Okay. They expect to lead assets to complete the PK bridging study in 2022. So, if you got in at 68 cents, let's just say you held, or you let for a drop when they short. That's your choice you got to make. Are you going to get in now, or are you going to get in, let's just say, next week or something like that, just in case the shorters get out, things like that. But you get in when you get in. You figure out your buy point. I'm not going to tell you your buy point because I don't know your buy points. But with it being a gamble, if they hit that everything that they say they're going to do in 2022, you're going to see some dineros. They could fail as well, and you could lose your whole ass. Sorry, excuse the French, but that's just is what it is. So it looks like with the potential advance directly into phase 3 clinical safety trial for subarachnoid hemorrhage, they have a combination of creates a unique rare disease company with innovative drug delivery, and they expect to have $64 million in cash at closing to advance lead clinical assets. So, with that news, like I said, 2022 comes around. You never know. You could be sitting there and you'll be like, I got a lot of money flowing around my house. You don't know. So it goes right there to that. That's one of the first pop-ups. So they're excited to have that pop up there. Let's see what else we got on here. They got another, for one of their programs, they got this Capri here with the Omega study. The omega-3 therapeutic Capri is designed for the treatment of hypertriglyceridemic through 2 phase 3 clinical trials. Sorry for the butchering, guys. It's been a way long day today in the sun. Trilogy 1 achieved 30.5 reduction in triglyceride levels in 12 weeks with a 36.7 reduction of triglyceride levels at 26 weeks and 42.2% reductions in triglyceride levels among patients receiving Capri with background statin therapy in 12 weeks. So what's the key there? The key there is that many Americans have problems with their triglycerides. They develop something similar with this, it's going to be huge. So this stock won't remain at that point. They hit their goals and they can remain their cash. And the thing is, as these develop more and things get more successful, people are going to see this and they're going to keep on piling in cash, and this stock's going to go up. So it looks like they have in 2008, the scientists have focused on the research to develop a new krill oil-based forms of omega-3 therapies for treatment of the cardiometabolic disease. The team, their passionate team, executives and scientists, I believe in them already just from reading it, okay? That's just my opinion. I think that they're going to do it. That's just, I mean, from what I've seen, I'm reading the studies. You can go along the website. You can look at the scientists. You can do it. They didn't pay me to say this. I'm just saying I believe in them. I'm looking at this. I've studied it enough that I believe in it, and I would say it's not going to stay in the cheap seats for much longer. I wouldn't be surprised, because I didn't pick this up on a promotion. I didn't see this on a promotion. I just picked this out myself. I just went through, I went on the hood and I was looking around. And it wasn't like it was popping like hardcore or anything like that. But I was just like, take a look at it. I wouldn't be surprised if I saw this on a promoter list. Not saying tomorrow, could show up a week or 2 weeks from now. So I'm pretty much done with this. I've checked everything out. You can go to the research. Great website. The website's up. Looks way good. So we're going to go to Investors Hub. We're going to get their opinion. We're going to cut off my opinion. We're going to get their opinion and see what they say. So, okay guys, going on Investors Hub. This is where we check out what the real traders are saying about this stock. Somebody put on their hit 66s. Nice. There's some heavy buying activity. Way nice. That's what they said there. ACST 57, partying face. See, that guy knows, that trader knows he's got his partying face on because he knows he's thinking ahead of 2022. He's like, cheap seats now, I load up, and then this blows up. He's in the 5s, 10, it just depends, you know? So cardiovascular, that's when that stuff goes, it's just gonna go deeper and higher. Modest gain here today. Holding pretty decent size here, waiting for more. I just tripled down on my small holdings. They got the video chart, 2 video charts were put up there, 5.7 and 5.19. You can go check those out. Pre-market looked amazing. Really expected more out of this today. Well, sometimes we can't have every day like that. So looks like Street Insider has 2 articles and filings that somebody posted on there. Someone posted an article about Global Newswire. Dollar bills, y'all. Was surprised to hit, some people are dumping. Something smells fishy, omega-3. That was a really, really bad joke. That wasn't my joke, guys. That was somebody else. That was pretty dumb. Where's the merger news? Well, the merger news, guys, is all over the Alphabet News. Look it up. So that's all. That's what I have. I don't see anything negative with this stock as far as from the Investors Hub traders. You can go check out Stockwits. They're a little more scrappy there, a little more active. I like Stockwits. There's some good people on there. They might have some scrappy hits that they have on there. Also, Stockwits has some good information as far as there's a lot of good experienced traders on there as well, and they have their hits. You can hit them up too. Ask them some questions. But if you are an experienced trader and you want to leave some things on here, go ahead and do it. But I'm shutting it down. I'm sunbeat. I caught a lot of fish today, and I hope your day was as good as mine. We'll be back tomorrow. Hopefully I'll have Cameo. It's just like I said, conflicting schedules with vacation and things. I've been really busy. He's busy, things like that. He's in the People's Republic of St. Louis, hanging out, partying. But don't make it a dog show, and keep it real. It's almost Friendly Friday. Good night now!